Hello, my name is Geraint Preest. I'm a GP working in South Wales and I'm a member of Coeliac UK's Health Advisory Council. Has your patient got celiac disease? Now, this is one of those conditions, if you don't think about it, you'll miss the diagnosis. 1 in 100 people in the UK are thought to have celiac disease. Only a fraction of these are diagnosed. There's a strong genetic link with celiac disease. So if a patient has a first-degree relative with celiac disease, then their risk of having celiac disease is 1 in 10. So you should consider testing, even if their symptoms are minimal. We're learning that celiac disease is more than just a gastrointestinal disease, that patients can present in a whole range of ways. They may even just present with neurological symptoms. If you're looking for patients with celiac disease, think first of all about comorbidities, because they tend to crop up with celiac disease a lot more frequently than they do with general members of the population. So we often see celiac disease in association with osteoporosis, with B12 deficiency, folate deficiency. The obvious one is anemia, but also hypothyroidism and even type 1 diabetes. There isn't an association with type 2 diabetes, but there is with type 1 diabetes. So if you're going through your results and you notice that a patient has a low folate, and it's completely unexplained, you haven't got a reason to suspect they'd have a low folic acid, then you ought to consider testing for celiac disease. As you know already, I'm sure, patients need to be exposed to gluten in order to test positive. So if you're testing a patient, check that they're still eating gluten, because if they've stopped eating gluten, then the test is going to come back negative. And if you're referring to a gastroenterologist for endoscopy for some histological diagnosis, tell the patient to continue to expose themselves to gluten until the endoscopy's been done. There's some great information on the Coeliac UK website, so have a look at that if you want some reliable information, and I hope that helps you a little bit with the diagnosis.